South Africa is to host the first mental health conference starting tomorrow and Tuesday in Ekurhuleni, east of Johannesburg. The two-day event will be attended by 700 delegates from 14 countries. It will consist of global mental health experts, policymakers and community-based mental health organizations. Key speakers on the first day will include the Deputy President Paul Mashatile and the Minister of Health, Dr. Phaahla. To speak a little bit more about this, Dr. Cassey Chambers is the Operations Director at the South African Depression and Anxiety Group and Conference Committee member. Very good evening to you and thank you so much for speaking to us. And I'm glad that you're a Conference Committee member because and I know it's not necessarily a branding issue, but I see at some points it's referred to as an African Mental Health Summit. We're saying it's the first Mental Health Summit. There's a press release that says it's the Mental Health Summit 2023. So I'm just wondering, there obviously must be something unique about this summit, but what is unique about it, and particularly the importance of the collaboration between the Department of Health with the Foundation for Professional Development?
Absolutely, and good evening, and thanks so much for letting us highlight the importance of such an event. Yes, it is its first South African Mental Health Summit, the conference that's taking place, as mentioned, with all these different delegates. I think it's bringing all these important voices around the same table for the first time in a very, very long time. And now it's more important than ever, where we start to highlight and prioritize mental health. And by doing that, we're needing the important stakeholders, government, civil society, medical health professionals, all coming together to say, what can we do to prioritize mental health? There's some amazing speakers, as you mentioned, from around the country, bringing new research, new innovation, best practices. And this is the first opportunity that we have to really focus on mental health in one space. And now is more important than ever.
And I'd like to zone into that, the extent of the problem. So you say it's the first, as in first ever mental health summit to be held on South African soil, or the first ever global mental health conference, because the distinction is very important to me when I look at the figures. It says prior to COVID-19, an estimated 970 million people globally had a mental disorder, and we know the problem has escalated exponentially.
Absolutely, and I think this is why it's so important to have this discussion. When we're looking at the fact that this is the first South African mental health conference, bringing everyone together straight after COVID, it's incredibly important that we discuss this. When we look at the global stats, as you've mentioned, we also know that the stats in South Africa are really alarming. 1 in 3 South Africans will or do suffer from a mental illness at some point in their lifetime. We also know that only 1 in 10 people with a mental health issue have access to treatment, which means that 9 out of 10 people with a mental illness do not have access to treatment, which is why it's so important that some of the discussions that will be taking place in the next 2 days with key decision makers, policy program developers, we're looking at public policy, we're looking at best practices and programs for mental health, we're looking at technology, because we as South Africa really have to take a serious look at how we're treating mental health. And this is the perfect opportunity to have all the people in the same room where we're all saying, what are we doing? How do we do it better? And how do we make sure to prioritize mental health?
Yeah, and I was just looking at some of the graphics that we put up there. 50% of people get that by the age of 11. I'm talking about mental health illness here. So country context is also very important. Now, South Africa is amongst the global countries ranked high when it comes to mental well-being, but the country also was found to have scored the lowest average score on the mental health well-being scale. So cognizance of these issues and also how we interpret them across the board. Can you speak to us a little bit more about how you are framing this discussion?
And this is why we as South Africa really have to look at innovative ways and having these key discussions, because we know that we don't have enough resources in the country. We really have to use the human resources that we do have, the facilities, to really make a difference. And this is where we start those important and sometimes difficult conversations. We're bringing civil society, mental health professionals, government, both from provincial and national, together to say, what can we do to fix this? When we're looking at the state of mental health in the country, so much more has to happen. We have to improve the level of care, the level of resources, the better patient journey. And for us at SADAG, this is incredibly important because we represent so many people who call us every day who are struggling to get help from clinics, who are struggling to get medication, who are struggling to know where to go and what to do. And this is where we're hoping to bridge those gaps and bridge that divide from the average person on the street who's really struggling to getting the help and care that they're needing so that they can live high functioning lives. You mentioned we often as South Africa, we always make the worst kinds of lists. We don't have a good global status with regards to mental health. And this is why we really, as a country, have to come together and do better. We have to come up with programs that are working, that are sustainable. We have to also allocate more budget to mental health programs in the country. So much more has to be done. And the only way that we get to start to do that by bringing everyone in the same room and having these discussions. And that's why we're really excited as part of the mental health conference and being part of the organizing committee. We've really had a say and influence into who are the speakers that are coming? What are the topics that we're covering? We're looking at digital and innovative technology that's really looking to bring mental health to so many more people around the country. We're also looking at programs that are targeting children and women. And these are really key areas once again. So when we're looking at covering the top topics that are important in this country at this conference, we get to do that. And hopefully at the end of those 2 days, we really have a clear idea and a clear action plan on how we're going to tackle the mental health crisis in the country.
And I'm just curious about this. Often, particularly when we talk about science, there will be areas of dissent. And I think for me personally, that's very important, especially if you say amongst the people you've invited are authors who are going to discuss research findings. Now, agreement on what is a depression, what is bipolar disease, for instance, how do you define mental health, particularly advanced mental health. And this is also against the backdrop of indigenous knowledge systems and how to treat some of these things. Is this what's going to be part of the offerings, and how is this going to reach the greater majority? Because that in itself is important. It's not just about the delegates talking about it.
Absolutely. And I think that's so front and center in what we're covering is how do we take this information and share it? And not just through social media where we'll be doing updates and tweeting live from the different sessions. It's also sharing this with the public and all the people that couldn't make it to the conference itself. I think we're also looking at this is going to become hopefully something that we get to do annually or every 2 years, where we have these key discussions that will keep challenging us and taking on the relevance. You bring in culture, which is incredibly important in our diverse South African and in our African continent, is that we're having to bring all these different multi-sectoral disciplines together in the same room to see how we're tackling mental health. And, you know, one thing that we're very aware of and also what I'm really looking forward to is while we're having speakers who are from, you know, top academics, top researchers from around the world coming to share new research, new findings, we're also having people with lived experience share their personal stories. And there's nothing better than hearing from people with real stories who are sharing what their journey has been like, what their challenges have been like. So that in front of these key decision makers, these key program directors, we're reminding them about that patient-centered approach, about the person accessing the help on the ground. And that's why a key focus in all of the plenary sessions and the track sessions is bringing in that human element, that real life element, which is so important. And as SADAG, we're also running a human library at the mental health conference where we have over 30 different people who are sharing their real life stories with delegates throughout the conference. We're encouraging delegates to come and sit for 10 or 15 minutes and hear someone's story about what they struggled with, what their journey has been like.
And Cassey,
so when
just
they go
before,
back to make these decisions, it's important.
Just before we run out of time, because I want to touch on this, 23 million children and teenagers who are afflicted with this, and your motto is to form a movement that talks about it, almost normalizing the existence or acknowledgement thereof of mental health illness. The Gen Z or Generation X or millennials, how they regard it and see it. Anything that pops out from the research that you're getting from the members of academia who are dealing with it, are there generational differences that we should be looking out for?
Absolutely. And I think what's also really significant is the impact of COVID, and especially the impact on teenagers and young people who are based in very low, impoverished areas, disadvantaged areas, who have no resources. So there's a big key focus as looking at what kind of programs are working, how do we upscale and build capacity around them. When we're looking at the impact of mental health for this younger generation, it's only going to become even worse when they go into adulthood. So it's very important, and there's a whole track that's looking at young people and mental health, because we're really having to come up with proper solutions that can be rolled out to, as you mentioned, the millions of South African young teenagers who are our next generation, who need more support, especially now. When we look at the high rate of teen suicide in South Africa, we have to do more. We have to provide more support. And maybe this might be the first step in the right direction to get some more updated information so that we can do and run programs around the country that really does work.
All right, Cassey, so much thanks for your time and insights. She is a conference committee member as well as operations director at SANDAG. We're talking here about South Africa hosting the first mental health conference, particularly started since COVID-19, as we mentioned, the growth of the incidents thereof.